Hi, my name's John. I've been a type 1 patient for the past 45 plus years. I'm also an emergency medicine physician in New Hampshire. I also spent about 12 years working with diabetes patients in northern New York as I ran a diabetes center and worked very closely with pharmaceutical companies, insulin pump companies, blood meter companies, and the works. I had an absolute blast. I learned a ton. It helped me care for myself and care for my patients. So now I've started this video series to enhance diabetes awareness and provide some education. My goal predominantly is entertainment because some of these stories are just funny and I love to share them. Also, hopefully, some hints, some ideas, learn from my mistakes, anything that can help. Please keep in mind this is not medical advice, this is purely shared stories and entertainment. If you get something that you might want to use, speak to your provider, keep everybody in the loop. So I'm really excited because this week, for those of you that have been following along, is going to be kind of cool. I'm stepping off the beaten path. If you followed, you know that I do that frequently. I did the type 1 basics. We looked at therapies and the basic physiology of type 1 diabetes. We talked about low blood sugars. Last week we talked about high blood sugars. I apologize. I was away for that one, so it was a little bit more technically difficult. I was planning on going into type 2 this week. However, I have the opportunity to give you another type of insight. So I'm going to spend the next few minutes interviewing my mother. My mother obviously was with me at the time of diagnosis and raised me. She has a keen insight and a lot of wonderful background. Caveat here is things have changed a lot. She doesn't have the tools that parents and loved ones have today. She doesn't have the easy access to education that we have today. However, she had a lot of drive and did her best to get education and use every available tool. But I think the emotional component and the feelings and the thoughts that were going through her head will be of value to you. So, without further my jibber jabbering, we'll get right on to her. Okay, so here we are with my mother, who was kind enough to do this interview with us. I have a bunch of questions that I'm going to ask her to hopefully give some emotional and some real life background to dealing with diabetes. My first question, Mom, is we grew up in the middle of nowhere. We were right near Lake Champlain and the Canadian border, very far from any medical care. So I imagine the diagnosis was a struggle. I'm wondering how you felt. What was that day like for you?
That day was absolutely terrifying. John had spent the day because I knew something was going on with him. I thought it was an emotional problem. One of my colleagues dealt with disturbed children. He also happened to be John's godfather. And I asked him to take John for the day and see what he thought was going on. Fortunately or unfortunately, they spent the day making Christmas cookies, and John spent the day eating frosting. When I picked him up in the afternoon, late afternoon, he threw himself on the floor and was just a miserable child. Ernie looked at me and said, "Gee, I've got some test strips. Why don't you take them home and test them?" In reaction to my saying, if I didn't know better, I would think John had diabetes. So I brought the test strips home. They were expired. Had John urinate on them. They were as black as they could be. Put him back down for his nap because I thought he was really kind of a cranky kid. Felt guilty, got him back up, did the testing again. Called his pediatrician in Vermont, and Dr. McKay said to me, "Get in the car, don't even stop to pack a bag. Bring him over immediately or take him to your local emergency room." I choose to go to the University of Vermont Health Center where Dr. McKay was chief of pediatrics. My first memory is you running down the corridor of the hospital and jumping into Dr. McKay's arms. Within 20 minutes, you had had your first insulin shot, and you were an entirely different child. You were happy, playing, not really upset about having a shot.
So you mentioned the urine test strips, just to give you folks some background because they're not used very commonly today. Purple was bad, so black obviously was ridiculously bad. I'm sure many of you on your own diagnoses or your child's diagnosis can tell us about blood sugars through the roof. Did they ever give you what my blood glucose was?
No, they never told me, but I do know from talking to other parents that most children go into a diabetic coma before they are diagnosed. We caught you a little bit early, maybe not too early, because there were a lot of changes in you and your personality happening at that time. Always thirsty. I think he was in preschool. You had a couple of accidents in school, which were unheard of. You were certainly potty trained at that point.
So with the urine test strips, and this is, again, we're back to syringes and bottles of insulin. What were the biggest challenges in those days for diabetes?
Cost was always a challenge for families who had a child or a member who had diabetes. Um, Insulin was a little expensive, as test strips were, the syringes were as well. But the biggest expense, I think, was to feed you correctly and all of the fresh fruit and vegetables. Um,
Gotcha.
Lots of challenges.
So, again, backwoods of northern New York, you have a background with education and nutrition and physical exercise. What did you do different, or how did you learn about diabetes management?
It was tough. I knew I wasn't getting what I really needed to know from the hospital, from the nurses and doctors there. I was able to do a couple of things right off the bat. One, I went to a conference at Joslin Diabetes Camp that was run by the Joslin Diabetes Center. I learned quite a few things from the docs there and the people there who had insulin-dependent diabetes. But the most helpful was flying out to the International Diabetes Center in Minneapolis, St. Paul, and going through a physician's program, which they were a little reluctant to let me join, but I was able to get into that program and learning as much as general practitioners did at the time.
So I know we've talked a lot about doing this video, and obviously my entire life about diabetes. That must have been a tough week.
It was a tough week.
Because you left me, a newborn, newly diagnosed, diabetic, alone.
I did. My mother was very helpful in some respects, certainly about giving him his insulin shot. Food was another whole other issue. She always said, it's all good food. He can have it. He can have all the strawberries he wants, all the juice he wants, and that was no longer the case. But I needed to do that for me, and also to learn how to help you with balancing diet, exercise, and medication.
Do you have any specific stories that stand out where you learned it the hard way?
A couple. Really, your first seizure terrified me again. I think you ended up in the hospital that day after spending the day making a film for United Way, an advertisement for United Way, with another doctor whose name was John, and the mayor of the city of Plattsburgh, whose name also was John. So we had three Johns. The doctor was like I am, not very good on film, and you had to retake the shot, the advertisement a number of times. In fact, I ended up going out and getting the toys to play with in the interim until we got the doctor to calm down a little bit. And unfortunately, you ended up in the hospital that night with that doctor. This was a time when doctors are expected to spend so much time in the emergency room every month in order to have practicing privileges at the hospital. And guess what? You being you, absolutely refused to let him touch you. He couldn't make a commercial. You can't do anything with my diabetes.
Keep in mind,
So
I was
that
probably
was a
5
little
or 6 for this.
That was a little tough. But I learned through the process that John did not have, that she didn't have epilepsy, that when blood sugars drop so low, you will seize. I also learned the hard way that some of your screaming at night was not indeed night terrors, as they diagnosed But again, a drop in blood sugar that needed to be treated on the spot and dealt with, and we put you back to sleep.
So, if you remember a few videos back, we talked about type 1 and some of the treatments. This was a result of the medium acting insulin, the NPH, it's typically called, or Humulin N. It had a peak that would occur about 4 to 8 hours after you took it, which was fine if you were eating lunch. But when you had a dose in the evening time, which was very typical, you took a morning injection and an evening injection, that spike in blood glucose would happen before bed. So, or I'm sorry, would happen overnight. So if the blood glucose wasn't high going into that time frame, you'd end up with a low, and sometimes pretty terrifying. I remember Randall talking about some of my nighttime lows, and I guess you folks had it down to a ritual.
We did have a ritual. We dealt with it as a family. Randall's job, Randall is my older son, was to make the toast and to bring it upstairs with a lot of peanut butter, to give John a little bit of a snack before he went back to sleep.
So, on that note, how did you deal with the other impacts on the family? Obviously, I've created a 2 a.m. get together for the family that I would scream about.
We essentially became a family with diabetes. I was determined to do a couple of things. One, not to let you use it as a crutch. I did that. I had childhood asthma, and if I didn't got up in the morning and said I didn't feel well, I didn't have to go to school. I didn't go to school until I was in 8th grade and just discovered I could be a cheerleader. Just didn't work, and I didn't want John to go through that process. I didn't want you to use it as a crutch in any way. I wanted you to grow up as an independent individual, as I did both my sons.
So speaking of schools, what'd you do for teachers?
At the beginning of each school year, I would talk to your respective teacher or teachers, some of the administration as well, and let them know how they should deal with you. No special favors. You might need to eat in class once in a while. Blood sugar might drop. Fortunately, I had a job that was just a few minutes away from the school, so there were times when I would tell my college class, take 15-minute break, I'll be back. And I'd scoot to the school, deal with the situation at hand, and come back.
So you talk to the teachers to warn them, educate them, and I would assume to alleviate fear. Did you ever have problems with fear in sports from coaches?
I did. I think you remember maybe when you were starting to play basketball after school that I think the problem was you brought a snack and ate before, and that terrified the coach. So you spent most of your time sitting on a bench. And when I addressed the situation, I was told by the coach that he needs to eat, he can't play. I don't want him to have a reaction, and we kind of set him straight with how you should be dealt with.
So is there a way to find a balance between safety and not making me feel unique and different? How do you tell parents? How do you guide parents to do the same?
That's a little tough. I think you each have to find, every set of parents needs to find their own way. But I think education, family, friends need to know what's happened. You certainly don't want to make the child afraid to admit or ashamed of having diabetes. It's part of life. You don't wear glasses. You don't have a hearing aid, as some children do. Diabetes is just something that you have to learn to live with and share with the others around you. I don't know if I answered your question.
No, I think it's individualistic. It really, there's. I think what you tried to do, at least what I got from your answer, is create independence, but enable me to understand that it's not a special situation. It's something I have to cope with and deal with, but I can still function like a normal individual. And the Joslyn was probably very helpful with that as well. What would you say? Well, let's flash back. Would you rather be a parent of a new type 1 in 1980 or in 2025?
Probably 2025. The technology is wonderful in terms of pumps and sensors and continuous glucose monitoring, maybe even a diabetic alert dog. Those are changes that we didn't have the advantage of, you didn't have the advantage of, and we sort of had to feel our own way. You have to understand, John, when you first were diagnosed, you were given one dose of insulin, and the human one was not available. It was either bovine, which was the cow insulin, or a pig insulin. Okay. And we used the pork insulin, which was a little more expensive. Most people were on the bovine. I was taught never, or instructed never, to change that insulin dose until I went back for my next visit, which was probably about 3 months away. So he was given the same insulin dose no matter whether or not the urine test strips indicated that he had a high sugar level or a low sugar level. I quickly learned to kind of slide that needle, the syringe a little bit. So if I saw something or thought he had a really high sugar level, I would give him just a little more insulin on my own, or I would reduce it depending on how he tested.
So what we're looking at here is there's no sliding scale. So for those of you taking multi-dose injections, imagine the same dose every single time. Mm-hmm. It's simple, but you all know your days aren't the same, your meals aren't the same, your stress levels aren't the same, and we definitely need adjustments.
Well, especially with a child, because the exercise isn't the same. I always said I could send John on an errand. I never knew if he was going to climb a tree, run, hop, skip, or jump, or slowly walk there, and all this makes a difference.
So you would say that, or I guess the question is, what technology you wish you had in 1980?
Probably the pumps and the sensors. When the pump did come out, it was about the size of a small transistor radio, and I really wasn't much in favor of strapping that on a child, and we didn't get a pump until you asked for one during your residency.
I actually remember the first pump was a backpack, which the Medtronic in Burbank, California has a very nice museum about pumps, but the first insulin pump was a full-fledged backpack. So I'd be rucking to school every day. So off of me, more importantly, as we say in medicine, first thing you do in a cardiac arrest is check your own pulse. How did you check your pulse? How did you keep yourself mentally sane and emotionally healthy?
With the support of friends and family, I think. Joslin Clinic and my involvement with some of the programs that were going on at Joslin really were very helpful. It was also extremely helpful for me to meet another adult who had early onset childhood diabetes. As I said, I was only recently told John I never thought he would live past 12. So to see someone who was very professional and who was an adult who had diabetes probably longer than John was a great experience for me. One of the fears I think I had as a parent was, would you ever grow up? Would you be able to go to college? Would you ever get married? Would anybody ever want to marry someone with insulin-dependent diabetes? These are all things that I think parents have to process.
I'm going to go off the beaten path. You mentioned this numerous times, and I think it's important that parents and those of us with diabetes here, you always talk about one of the issues with diabetes is the disability that you can't see. Give me a little more about that.
Absolutely. I firmly believe that diabetics, people with diabetes, are shortchanged because as doctors look at the child, or in most cases, the adult, there's no visible disability. It would be easier for them to deal with someone who had a lost leg or something that was easily detectable.
Sure. So let's do this one. Looking back, 45, almost 46 years now, with all that you've accomplished, raising 2 kids, a beautiful home, a great life, What are you most proud of?
I would have to say I'm most proud of the way you dealt with it. John has never said to me or anyone else, to my knowledge, why me? Why do I have both juvenile rheumatoid arthritis and diabetes when there is no other family member who has experienced either of these two diseases? Um, John was easy. You were always easy to teach. I know you always didn't follow what you were supposed to do, but for the most part, you understood that without insulin, you didn't live.
Sure.
And there was a lot of biofeedback, to use a term that made you want to take your insulin. One of the things I did do with Jonathan that I'm not so sure I had doctor's approval to do is when we finally got glucose monitoring in place and he would test his blood, I'd give him the opportunity to say, or guess what his blood sugar would be. And if he got it, I think we gave him $1. And I was trying to get him to understand how he felt when he had either high blood sugar or low blood sugar or normal blood sugar.
So a great technique, and I think there's a lot of other ones that you did that it's been a while, but I remember being traced on the ground on a big piece of paper,
Okay.
and then I would be drawn as a cowboy or an astronaut or something, but little dots were made on the arms, legs,
We
and
used a
rear.
penny to make the
Okay.
little dots, and that was where John had his shots because, of course, we had to rotate his shots. So after he had his shot, his morning shot or his evening dinner shot, he would go over and check where on the chart, which hung on
the bathroom door.
Hung on the bathroom door near the kitchen, and
we did that. We had numerous, and I'm sure any parent out there has gone through this, numerous stuffed animals that took injections as well.
Yes.
Halloween was always fun. I trick-or-treated as much as the next kid, and I would trade that candy in for a gift of something. Most likely in those days it was Star Wars, but there's always something to make Halloween special and not make me different. Which I think
we did the same with Easter as well. The Easter Bunny came and brought a lot of candy for both children. John and actually my oldest son did the same thing too because John was getting another gift to replace the candy, and he wanted to do exactly the same. So
neat little hints and strategies for parents. So on the dealing with it and not ever feeling guilty, and I've told these folks before, I love the disease. What do you think helped me become independent and cope and learn to understand? What did you do that made that work?
One of the things that I observed from being at Jocelyn Camp and working with people who had diabetes through the American Diabetes Association was that a lot of children who were insulin dependent also became mother dependent, parent dependent. And I was bound and determined that was not going to happen. I think I remember saying to you as a very young child, you need to learn to manage all of this by yourself because I could be hit by a car. And I will not always be with you or at your side.
So I also remember the reality hit when I wanted to run away. Now, most parents may hug and tell the child, you don't want to run away, we love you, blah, 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 blah. I was told, well, you're going to have to get married. Well, I unpacked immediately and went back to my room. So the reality of the world is a good thing to share with our kids. What advice, what message would you give to all the parents out there that are starting this journey?
John, please, diabetes is extremely complex. Learn as much as you can about the diabetes. Spread that knowledge through your family, and especially to the person with diabetes. Help them to become independent. There will be times when you will have to let your child do things that you wish they weren't doing, such as sleeping out in a camp near a stream or driving cross country by yourself. That was a little scary for me. Or even having a car and being able to drive to school.
Or spend the whole day on the pond.
Yes, well, we did have two ponds on the property that John would play at.
And keep a kid away from water. Well, thank you very much for everything, and obviously for this interview. I owe her my life, and we look forward to. If you folks have questions, comments, things you'd like to hear her opinion on, please post a comment, send me a message. We certainly can do another one of these in the future. Lord knows I rope her down here enough for help every chance I get. So if you have other areas you'd like to hear about, be it school, sports, college, independence, education, let us know, comment, give us some ideas, and we'll go from there. Thank you all. So that concludes the first interview with my mother. I'm blessed to have her. I can't thank her enough or love her enough for everything that she's done for me. As you can see, she's always willing to support and help and educate. She's been a resource to her own community for folks with diabetes, for parents of folks with diabetes, her entire life. So if you heard something that you'd like more elaboration on or have other ideas or thoughts that you'd like to discuss, please let us know in the comments and we'll definitely get back to you. As always, diabetes is a lifestyle. It is in the back seat. Respect it. Drive your car. Don't let it run your life. Look for independence. Inspire independence in those around you. But don't make yourself feel special, or don't let your children feel special because of their condition. Certainly not a crutch any of us need. So again, a special thanks to my mother for all of her help and support. I hope this was helpful for you folks. Please comment, like, and subscribe. Give us your ideas and your thoughts, and we will definitely move forward with them. And as usual, and most importantly, stay healthy.